Peripheral vascular disease is a disease process that affects the blood vessels in the body outside of the heart. So blood vessels such as the arteries and the veins. Arteries carry blood down to the rest of the body, and veins bring them back to the heart. As vascular surgeons, we treat blood vessels outside of the heart only. So vessels that involve the neck, that go to the brain, the big artery in your chest, the big arteries in the abdomen, arteries that go to the kidneys, the liver, the spleen, and then of course the arteries that go to the legs and the arms. But then we also treat all the veins that bring blood back to the heart as well, specifically veins in the arms and veins in the legs. And so as a vascular surgeon, we essentially do the entire management of the vascular patient as far as ex vivo the heart is concerned. So outside of the heart, all the blood vessels are managed by the vascular surgeon, both medically, surgically, and also in the management of these diseases using minimally invasive techniques.
Probably most importantly is most vascular disease is completely asymptomatic, and so unfortunately by the time you realize you have it, it's oftentimes too late. So really the best way to know if you have vascular disease is to be screened.
Well, it depends on the vascular bed involved. So in the carotid arteries, dealing with blood vessels or blood flow to the brain, those are stroke symptoms, which can be weakness or numbness on one side of the body, inability to move an arm or a leg, inability to get the words out clearly. Also blindness in an eye, complete blindness in an eye, and those can be temporary, last even a few minutes. In the vascular bed to the legs, the early symptoms are usually cramping pains in the calves, sometimes the buttocks and thighs, depending on where the location of the blockage is. As it gets worse, it can be constant pain down in the foot, or even gangrene or ulcerations.
Screenings can involve any type of blood vessel in the body. So the most common ones are to screen the neck arteries that go to the brain to see if there's a blockage in those arteries. As Dr. Hasnaka mentioned earlier, some of the symptoms associated with those arteries that can be blocked. Arteries that are blocked in the legs can also be screened by simply putting a little cuff on the ankle and measuring the pressure in the foot. And that gives us a very good idea of whether or not the patient has good circulation or bad circulation to the feet. It also gives us the ability to decide whether or not a wound or an ulcer or a sore on the foot will actually heal or not. So that's one of the most common ways to look at it. Of course, the goal is to prevent those types of complications from happening. And as Dr. Ash said, because most of the disease is asymptomatic, it's very important that we screen for these problems with these simple exams to be able to find the problem before it creates a major catastrophe. The last thing that we also screen for also is an aneurysm in the belly, which is very common. In fact, as our population is aging, we're beginning to see that more and more. Just a simple ultrasound exam of the abdomen, which takes about 5 minutes to visualize the aorta, can tell you whether or not the patient has an aneurysm. Of course, the consequences of not finding the aneurysm can result in the aneurysm growing, eventually bursting, causing the patient to lose their life.
Vascular surgeons sort of function as primary care physicians for the blood vessels. Typically, patients come to our office by way of referral from their primary care physician, or sometimes patients self-refer to our clinic. Obviously, we see patients in an outpatient setting in the clinic, and from there we make decisions about how to manage their disease. Many times disease can be managed medically, meaning that we don't have to do a procedure. We do open surgical procedures like bypasses and aneurysm repairs. Fortunately, much of what we do today can be done in a minimally invasive fashion, and that typically would include a stent or a balloon, sometimes called angioplasty, which is what patients may commonly hear on the news. So there are a variety of ways that we can perform those procedures, and we do them in a variety of settings. There's a clear association between wound care and vascular surgery in that many patients who have wounds have them as a direct result of vascular disease, and the reason the wounds don't heal is also because they have vascular disease. So there's a clear connection between the two.
Diabetes is very prevalent in our society, but it also accelerates vascular disease. So the type of risk factors you ordinarily would have, whether it be genetics or smoking, diet, towards vascular disease is accelerated if you have diabetes. So good diabetic control, good blood sugar control will really help that. Diabetes also affects the smaller blood vessels, typically below the knee. Therefore, those patients don't usually have the same kind of crampy pains as they walk, like other vascular patients might. But they've oftentimes had pretty bad disease that can lead to ulcers and gangrene.
Yeah, our initial interest in moving to this area as a team was because of the fact that there was a significant underrepresentation of vascular care on this side of the state. Vascular disease, as I mentioned earlier, as all of us have mentioned, is a growing problem. It's becoming much more prevalent. In fact, it's accelerating at a rate faster than most other disease processes. The main thing about vascular disease is that it's connected to other diseases as well, diabetes, heart disease. I mean, most patients who have heart disease also have peripheral vascular disease, but they don't know they have it. So unfortunately, on this side of the state, there really hasn't been a true vascular specialist to really be able to manage those problems medically, surgically, and with interventional techniques. And that's something that the three of us bring in a robust fashion, because we can do all of those things as one person. And that's never been really practiced on this side of the state, which makes it a very unique opportunity to bring a vascular team into the area to provide a holistic vascular approach to treating the vascular patient. Well, as vascular surgeons and where we were together as a group before, we were involved in multiple vascular trials that brought us national recognition. Our plan is to bring a lot of those trials here as well. In fact, we'll be starting about 2 or 3 of those trials, hopefully within the next 4 to 5 months, here at Christie Clinic in affiliation with the President's Covenant Hospital. Some of those trials will revolve around abdominal aortic aneurysm, new technology for abdominal aortic aneurysm disease, some technology for thoracic aneurysm disease, and also some new technology for arterial problems in the lower legs. We have had a very long history of working with research trials, and we have a good reputation with the FDA, so that I think will be a huge benefit to this community and this region as well on this side of the state, since they haven't seen that type of a technological advancement. So we're really excited about that. Currently, I do serve as the national principal investigator for one of the abdominal aortic aneurysm trials, and so that hopefully will get started within the next 3 to 4 weeks here at Christie and at President's Covenant.
Clinic sites will be at Champaign-Urbana, and then we'll also offer additional clinic sites in Danville, in Watseka, Illinois, associated with Iroquois Memorial Hospital, in Monticello, and also in Paris, Illinois. In the coming months, we're hoping to expand regionally to other sites as well to make it easier for patients to get in touch with us and see us to provide them with vascular care.